Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
And good morning. I'm Dr. Kim Allen Williams, chair of medicine here at the University of Louisville, and we had a very stimulating and informative grand rounds this morning. It was given by Dr. Anil Trindade, who is an associate professor of medicine at the Vanderbilt University, and he is the associate medical director of the lung transplant program. He gave a really informative lecture on lung transplantation as therapy for advanced lung disease, the past, the present, and the future. Dr. Trindade, can you give us a 1-minute summary of your talk?
Yes, well, thank you so much, Dr. Williams. Over the last hour, we spoke about lung transplantation and its evolution, and really as how outcomes are improving, especially over the last 40 years, where median survival has now improved from 5 years to 7 years. As a result of the improved outcomes with lung transplantation, we're thinking about it more as an advanced therapy. And so what we reviewed were some of the indications for when to refer somebody with advanced lung disease for transplantation. So for somebody with interstitial lung disease, do they require supplemental oxygen? Do they have pulmonary hypertension? Sometimes even just having a diagnosis of ILD is criteria enough to at least see a transplant physician. And then we also talked about referral criteria for patients with advanced COPD, mainly using the Bode index to prognosticate. So that's lung transplant in a nutshell.
Well, it's really fantastic. It's great to hear that you're really tripling the function of people and extending their lives. And I like that last line that the only two contraindications are no lungs, no surgeon.
Yes.
So, all right. Really appreciate all of the information that you've given us this morning.
You.
And this has been a Cardinal Minute.